Thank you, President Jorgensen. I am grateful to you, Lena, and the MAPE leadership. I want to let all members know this team is not just, as I've said numerous times, they don't just have your back, they have Minnesota's back. They're helping shape the policies that move the state forward, and they're making sure, and I'm very much looking forward to hearing from Steph, Maureen, and Lois about frontline work at critical agencies. But please know what you're doing is making a difference. As I've said the other night on the state of the state, there's going to be some tough times to go through here, but we've got the capacity to get through it. And as I was just telling Chet, I got off the phone with a pretty extensive brief with our partners in the modeling at the University of Minnesota and MDH. What we're doing is working. And there is a very Minnesota path forward to both protecting our most vulnerable, to extending testing and sentinel measures out there, and getting folks back to work and moving back towards a more normal lifestyle. There is a way that we can do this. We're at this point in time, because of all the work you're doing, holding our own against this. But I want to be very clear. The lack of personal protective equipment is putting way too many Minnesotans and folks on this call at unnecessary risk. We are spending all of our energy to try and secure that. And the testing, we need to have more of that to allow for us to be more strategic in what we're doing. I certainly hope that the COVID leave policy that your leadership made absolutely clear was necessary is working for you. We know that so many of you have spouses that are unemployed now, child care issues coming up, all the other concerns are out there, in addition to keeping the state safe and continuing to lead. So I'm grateful. I'm gonna mute my phone here for a minute and listen to stories from the front lines and then come back on again. But thank you all for what you're doing.
Governor, thank you for joining us today and for leading Minnesota through this pandemic. This is Lena Jamoli, Executive Director of MAPE. Can't be easy being governor right now, and we've all been grateful for your thoughtful, decisive, and transparent leadership. We're also grateful to all of our members and the work you've all been doing to keep state services functioning during these challenging times, and some of you are doing that in conditions that put yourself and families at risk. We're thankful for your dedication. Governor, we wanted you to hear directly from some of your employees who've been working hard to keep Minnesota moving. There are thousands of stories we could have picked from a variety of agencies, so the next three stories don't capture all the work our members and your employees have been doing, but they're the tip of the iceberg of the state workforce. First up is Steph Meyer from the Department of Health.
Hi, thank you. As Lena said, I'm Steph Meyer. I serve as MAPE's Region 9 Director, and I'm also one of the senior epidemiologists at the Minnesota Department of Health. And we have an incredible team at MDH. It's been all hands on deck, drop your usual work, get involved. I mean, everywhere you turn, people are stepping up. They're working until 8 or 9 o'clock most nights. We have people here every weekend. And I'm proud to be part of this response, working every day to keep Minnesotans healthy and make Minnesota a safe place to live. In our case investigation team, we're contacting confirmed COVID-19 patients, and we're talking with them about their exposures. We're finding out who they've been in close contact with, and we're handling isolation and quarantine. And we've been following up with healthcare workers. If a physician, for example, were to test positive, they may have exposed their colleagues, their patients, the healthcare staff who tested them. So we're assessing all those risks and trying to ensure we have a healthy workforce in our hospitals, in our clinics, our long-term care settings, group homes, and many others. We're trying really to draw a circle around each case, find the contacts, isolate and quarantine where needed, and then move on to the next case. And if we can contain illness in these spaces, you know, it's, as Governor Walz said, it makes a difference. It's going to make a difference to the burden on our healthcare system. And really, in a small town, if you have 2 nursing homes where everyone gets COVID-19, what do you do for your community? Our hospitals will be overwhelmed to care for the most vulnerable folks who become ill, and we've been hearing it from our colleagues in other states. And this is where we'll need to work across agencies on plans to assist in staffing facilities just to stop the spread of disease. I'm really grateful for the emergency care that my kids are able to get. I've got 4 kids, and I wonder what happens if I get COVID-19, or what if one of my kids gets it. And it keeps me up at night, but Governor Walz, I can't thank you enough for making education a priority for our kids. We couldn't do it without that support. And this is why we're also trying to work with our agency to operationalize remote work, because we know that someone here is going to eventually test positive for COVID-19. The epidemiologists here on staff, we talk about it every day, and as careful as we are, we know it's likely that someone here will get it, and then what happens? So we're working towards solutions to keep ourselves safe and keep our operations running smoothly, because we really care about the state of Minnesota and what we're doing. So thank you.
Thanks, Steph. Next up is Maureen Dunaway from Deed.
Hi, this is Maureen Dunaway from Deed, and I work in the unemployment insurance program. And I can say each and every one of us at UI is working hard to serve Minnesotans. We are on the phone the entire time during business hours, leaving us to work overtime to determine eligibility. We're thankful to those who have come back from retirement and those who are redeployed to us and are getting a crash course in how to do our work. But we are still short-staffed. In the last 3 weeks, we fielded over 300,000 applications. Wait times are, as expected, longer than usual, leaving some callers frustrated. But many callers are thankful and understanding. If you know of anyone who is going to apply, please encourage patience and maybe give them a hand. And for the first time at UI, people are beginning to start teleworking. We started this last week. I was approved last week, and so far for me it's going well. Not everyone is being approved for this so far, so I am hopeful that more of my colleagues will soon be able to join me. These are certainly unprecedented times. I thank our department and all of my fellow MAPE members. All deserve kudos. Keep up the good work, everyone. Thanks.
Thank you, Maureen. And the last member we'll hear from today is Lois Tuckey from the Department of Corrections.
Hi, thank you, Governor. My name is Lois Tuckey, and I provide deaf and hard of hearing services in the Department of Corrections. At a time when the entire state is encouraged to stay at home, many of us at the Department of Corrections are serving Minnesotans on the front lines, both inside our correctional facilities and in our communities. MAPE professionals within our facilities continue to provide critical services that our offenders rely on, including much-needed mental health services. Our supervised release agents and our case managers play an essential role in our offenders' reintegration into society. Facility wardens here have developed and implemented stay with unit plans, which is a prison's version of stay at home, and our agency has modified programming schedules to encourage social distancing as much as possible, but it's a challenge. Our employees working inside the facilities and in the community are working hard to manage our population, but are at increased risk of contracting COVID-19. We know you're working to ramp up production of personal protective equipment, and we're thankful for that. We're also grateful that legislators have recognized the need for workers' compensation for frontline responders, including all essential DOC staff. This is an unprecedented time in our world, so it is vital that the agency be creative and work with the employees to develop new approaches to staffing, schedules, and programming plans in our facilities that keep everyone healthy and safe. And we appreciate the work that you're doing. Thank you.
Thanks, Lois. While our members are keeping Minnesotans safe, our job as a union is to keep our members safe and make sure they have what they need to do their jobs. Governor, we're not naive about the effects of this pandemic on the economy and the state budget. It's not yet clear how much the federal government is going to support state government budgets. We look forward to working with you on a fair and transparent process around the impact on state employment. And we ask that you continue to work with us, especially as the decisions get tougher. So, Governor Walz, do you have anything you'd like to respond or react to our members? We've got almost 4,000 people who have joined us on the call now.
Well, yes, Lena, thank you. And those are 3 of literally 4,000 stories. These are also the stories that will be told for years, if not generations to come, about what happened during COVID-19 and who was there to respond. The historic efforts of MDH doing the tracking. We're not going to rest on our laurels, but at this point in time, our infection rates are lower than any place in the country. we know that one is too many. The same thing I say a lot about UI, and these are folks that many people did not know what they did for so long. We had low unemployment rates, and they simply did their work and did it well. When the system came under strain, UI systems across the country crashed. Checks have not been paid in Connecticut for over 3 weeks. I got a text today from someone who applied and had a deposit in 3 days in their bank account and said that nothing could have been done to make them feel more at ease than that. So I want to make that case. And then the folks at DOC, corrections is always a challenging job. We know from aging facilities to overcrowded facilities to just the challenges that come, trying to keep themselves safe at the same time that they're trying to show basic humanity to those who are incarcerated is heroic work. And I can assure you, President Jorgensen and all of your members on this, when this is over and we pick up the pieces and do state budgets, we are not about to undermine the very safety net and the people that made things better and saved lives at the expense of trying to balance a budget. So there's going to be hard decisions to make, but everyone on here can rest assured it is not going to be the time to pull back the very things. I am so proud that Minnesota has a robust state workforce that are true professionals because it's right now when you needed them. So those that are going to come when this is over and tell us that we need to get rid of all of these things, these are the very things that got us through it. So I'll continue to work with you. I've appreciated the incredible amount of cooperation, and I think it's important to stress to the 4,000 members on here, the leadership of MAPE is at the table on all of these decisions. Their voice matters, and they are doing right by you. So, Lena, thank you all. I'm